a couple of words on the. Anyway, so let us start and yeah, let us begin.
Dear colleagues, I am Glišović Krivec from Spomenčica, Alzheimer, Slovenia, and I will talk on technology-based tailored integrated care services to promote well-being. Now, please let me introduce the work we are carrying out in Tender project that has the main goal to promote well-being, increase the quality of life of people with Alzheimer disease or other dementia, Parkinson's disease, and cardiovascular disease. But what is very important, to support all that live and provide services to those patients. The question is if the technology-based care services can promote well-being. For improving the well-being of a person with dementia, we need to facilitate quality of life of that person and the care partner. Therefore, the inclusive design is needed. That means to listen and understand the people's needs and wishes. Various types of technology-based assistive products are already on the market, but a variety of products can create challenges to be used. The technologies are increasingly vital in present activities in homes and communities, and we all encounter them in a daily living. Moreover, despite the fact that many technological products are already on the market, some limitations exist and technologies are not widely used. So Tender aims to help patients and all in the care pathway by addressing difficulties experienced in independent living and care arrangement. The services are integrated to automate, support, and extend the care supply chain. Tender services will also create opportunities for facilitating social and healthcare professionals' communication and ease the communication with carers and others in care service. We are facing healthcare challenges due to the rising of chronic diseases and the aging of the population. One of the greatest care challenges we face is that the number of people with neurodegenerative diseases is likely to rapidly grow in the future, and most of them will require 24-hour care services. So the families of patients will also need support and care. Tender is a multi-sectoral project founded by Horizon 2020, and it includes 13 partners from 7 European countries working together to help people. We are developing the personalized and patient-centered service that is modular. We are involving patients and public. Thus, we see the potential users as experts of their own experience that is the central to our development process. In Tender, we are using various micro tools, wristbands, Bluetooth scanners for the position tracking, sleep sensor. Some wristbands also allow to track steps, heartbeat rate, and Tender partners are coming from user organizations, small, medium enterprises, academic institutions, policy experts, and thus Tender as a consortium reflects how EU-funded research can cut across disciplines, sectors, and country borders to benefit societies. So partners come from Spain, Portugal, Brussels, Germany, Italy, Greece, and Slovenia. Spomenčica focuses on the experience and the results of the co-design with people with mild dementia, their relatives, carers, professionals, and employees in various institutions, like in healthcare sector and social care sector. So all were included in pre-piloting and mock-up testing and testing phases in the Tender services at Slovenia piloting site. And the main goal is that the person is an expert of his or her experience. The first co-design process phase was set and performed in pre-piloting of the project, while the second co-design phase was spanning through the first and second wave of the testing, of the piloting. We created different scenarios for different living environments, like hospital environment, daycare center, rehabilitation room, and home scenario. And based on the person's wishes, we can apply different models of tender service. Based on this and user requirements, we have adapted functionalities for the tender. So the aim of the co-designing tender was not only to improve the efficiency and effectiveness, but also to enhance the satisfaction of those who take part in the process. We firstly explored the service provision flows in European countries involved, dived into people experiences through observation study, and based on the expert knowledge of the partners. Therefore, in the first phase of the project, we summarized the existing situation in different countries. We also integrated knowledge from previous project and from the state-of-the-art relevant literature. We can see that there is obvious a general fragmentation of the services that exist, and thus there is barrier for people to get the full potential from the services that are already present across the Europe. Then in the testing phase, we involved people in mock-up testing and also in piloting. That means that they were allowed to test the system with different integrated devices in their home or in hospital or rehabilitation room environment. The system is being developed in a way that has many modules that can be applied to different environments, but also we had a goal that it can be adaptable when the disease progresses. Therefore, the involvement of users like patient carers, but also professionals in care pathway is crucial to adapt and integrate the technological solution in real-life situation, as they are the only ones that can test and talk about their own problems, provide advice like opinions, also experience, suggestions, and express their rights on how they want to use the technology and supported solution. How we did it? The most important thing is the communication and the involvement of diverse users. So if people don't trust the technology, if they're afraid to use it, then we can have super solution, but for no use. And what we found, each of user group has its own unique perspective and needs about the technology. Moreover, also the researchers that were testing the solutions with people were included in additional survey, so to provide feedback about the observations during the real-life testing. They provided their feedback on the perception of the protocol we are using, inclusion criteria, ethical challenges, concerns expressed by different participants, feedbacks about usability, and perception of efficiency, and they also provide comments. So all the participants are involved in the formulation of our solution. Their views may differ, and mostly what we found is that in most cases, patients are already using phones, some also PCs and tablets. Some are familiar with smartwatches and similar devices, but most of the patients don't feel the need to use new technology. But some would try if someone would help. According to their opinion, the intelligent monitoring system is not very useful for them, and most of patients see themselves in a stage of the disease that functions presented are not of great usability for them, but may help other patients or patients that are in some other stages of the disease. Some patients also mentioned that it would be important that the system does not immediately act, but gives the patient time to act himself, herself. And some expressed the uneasiness that the increase of their independence would lead to decrease of face-to-face contacts with other people. So they all said that more than technological services, they would appreciate to have more human company, as they often are bored and left alone, especially in COVID times. So here you can see some of the functionalities that were proposed to be integrated in tender. And as mentioned, people didn't accept the functionalities that were related to affective state, and the location tracking was viewed useful only 50% of participants. Mostly they viewed this useful concerning for helping in case someone needs, but not themselves, So it was viewed as a service that may be beneficial for other people that may have orientation and confusion problems. But nevertheless, they were interested in fitness monitoring, heart rate, and counting steps. The sleep quality tracking functionality was also very accepted. On the other hand, carriers were more open to use of the intelligent system. Most carriers accepted the technologies that were presented. Some expressed concern about how care receiver will accept it. They mentioned that the interfaces need to be simple with big buttons, fonts, and screens. And as current solutions are often developed mainly for healthy young people, they mentioned that the solutions should be adaptable to the needs of elderlies. Some expressed concerns about the financial perspective, as the system will be developed only for a small group of people in society that can afford it. That was their view and their fear. And they also emphasized that for them it is of great importance that a system or a service enables them to have more freedom, more time for themselves. So according to the professionals that were interviewed, technologies would be useful in professional practices in order to have better data and work management. However, they also said that the technological devices are often complicated. In general, they viewed the proposed functionalities useful. So we proposed some models for testing, and when testing, the researchers were collecting feedbacks. And the most common topic that was raised was about privacy. Who will have access to the data, reports, but also live data? Who will be involved in viewing the results? Can some functionalities may be disabled maybe someday, and so on. So the physical health and subjective well-being have a bidirectional connection. Well-being has a protective role in health maintenance. Therefore, the awareness of the importance of having insights in people's daily living, habits, and other insights is rising in healthcare sector. Correlations among different well-being related parameters create potential opportunities to implement new effective pharmacological, therapeutic care, and above all, preventive interventions. Subjective well-being mainly refers to an individual overall evaluation of the quality of a particular stage according to the standards set by oneself. Therefore, we need to understand that when we are researching the impacts on the quality of life of a person, well-being and quality of life go hand in hand. For example, the concept of comfort, inclusion, identity, and attachment may be used to characterize the subjective well-being. So well-being is considered as a state of being comfortable, healthy, or happy. And the focus is on identifying which approaches will be effective for people with chronic illness based on environmental, lifestyle factors. Different daily life resources can be therefore used to assess the well-being parameters. And what we can find is that even when the system that track these parameters may be technically functional, it seems that it may not work for specific individuals. We can see that person with dementia quite sometimes doesn't recognize himself or herself as being in need of help or assistance. And supporting and maintaining activities is a major theme for the future treatment and prevention of dementia or its progression. So a proper presentation and the dialogue can enhance the trust and help people to lose their fear against the unknown. And what is very important, the providers should take into account that as the devices and apps are constantly updated, but also new versions and modules are coming into the market every few years, this may be a barrier for usability for some people. Therefore, when involving people in technology testing, we need to put ourselves into their shoes and carefully plan the testing in a way that the workload expected from the participant is minimized. We need to understand the complexity of tasks we assume the participant will perform and also minimize the threat that they would over-rely on the technology, especially if this is the testing or development phase. So there is a need for a reliable, error-prone system in order to introduce mentioned parameters in decision-making in the future. And in the future, it will be more and more important that we give the services that allow that daily events and data gathered could benefit to personalize the approach to a person in a proper manner. Very important topics are maintaining human contact. As among the discussed risks, there is also social risk for reduced human contact because of the use of the technology-based care services. And of course, the affordability, so not as to have inequalities because of these new technologies. What we found in tender is that a collateral effect of the piloting was increased digital competencies among both carers and patients, as the researchers provided some basic training for the use of the smart devices and apps. And this was really nice to see. So I would like to thank all partners that are collaborating in this project and putting the efforts to improve the quality of life for different stakeholders to facilitate the transitions to use the technology, but in a friendly and safe way for patients. Please visit our tender website and subscribe to newsletter. And thank you for listening.